Well, more than two-thirds of working families in New York City can't afford home-based child care. This is according to a recent report tracking early childhood poverty.
So the study finds 1/3 of women who work outside the home choose not to look for a job due to the lack of affordable child care. 53% of mothers who live below the poverty line experience challenges at work because of child care disruptions. Those working moms are also twice as likely to quit, change, or lose jobs, which leads to economic instability. So joining us this morning to further break down the findings in the report is Dr. Kelly Escobar from the Robin Hood Foundation. So good morning, Dr. Escobar. Thanks for taking the time to be with us this morning.
Thanks for having me here today. I'm really excited to talk. Well, not excited, but I'm thankful to be talking about the crisis of child care here in New York City.
It's an important topic, right? And this is actually part of two separate reports.
That's
Can you
right.
explain that and then what the findings were?
Yeah, sure. Happy to talk about it. So the Robin Hood Foundation is New York City's largest anti-poverty fighting philanthropy. And we've been partnering with Columbia University since 2012 to put out our annual poverty tracker reports, which are signature studies that take a pulse on the state of poverty in New York City.
Okay.
And recently we released two reports that are looking at specifically on the child care landscape in New York City. And what we found was extremely alarming. That right now, the state of child care is just not adequately serving families with children under the age of 3. There are not enough child care seats, and child care is highly unaffordable for families. I mean, we're talking about families who are spending about 30% of their annual income on child care alone. Wow. So to put that in perspective for you, if a family of 4 living in low income, which is about $87,000 per year, is spending about $26,000 of that on child care alone.
Crazy.
So compound that with housing and with the cost of living, and we're thinking about a trifecta here of financial instability that are forcing families to make really difficult choices like leaving the workforce.
Yeah, absolutely. All right, well, let's talk about the outcomes. Home-based child care, it's a lifeline for certain families. They rely on these services. Who relies on them the most and why?
Home-based childcare is really a service that is available to all families and actually is often the top choice for many families. They are often considered as more affordable and is usually gives a lot more hours of flexibility for families, so it's really appealing to working families who have different schedules. And our report does indeed find that about 20% of families with children under the age of 3 are utilizing home-based childcare, and in particular in New York City, Black and Latinx families are utilizing home-based childcare about twice as much as other parents. And indeed, other than that, in terms of low-income families, we are seeing that about 72% of families that are utilizing home-based childcare are indeed living in low income below the poverty line. And they're using subsidized childcare to be able to do that, the public child care assistance program. So we know that right now, without that program's existence, about 2/3 of families can't afford childcare at all.
Wow. So what's the long-term economic effect then? I mean, there is no really a lot of affordable childcare out there. So what is that?
There isn't, and it really means that families are being forced to make really difficult choices. And so when mothers in particular who are carrying the brunt of these choices are forced to leave the workforce, family income to that household is reduced significantly. And we find that up to a year later, those families are 1.5 times more likely to be experiencing financial hardship.
Zoom in for us a little bit. Which boroughs, which communities are really suffering the most?
Yeah, I mean, it's definitely an impact on all families and all boroughs across the city, but in particular, our report is finding that families that are living in low income, that are coming from Bronx, Brooklyn, and Queens, and families that are identifying as Black and Latinx, more specifically, are most negatively impacted. And when you zoom in a little bit into the Bronx, we're seeing that about 1/4 of families are utilizing home-based childcare, and when you look as their only form of childcare, mind you, and if you look into Queens and Brooklyn, about 15% of families are utilizing home-based childcare either on its own or as a supplement.
Yeah. So what's the solution? I know that's a big question and a big ask, really.
It's a huge question, and the question that really needs to be front and center of all policy and lawmakers right now. The bottom line is that we need more affordable childcare, more accessible childcare, and we need childcare providers to be paid the rate that it costs for care, so we have those seats available for us. policy recommendations really should keep front and center how we might increase subsidy rates so that families are paying much less out of pocket and that child care providers are being paid the exact cost of care, and even paid family leave policies so that families aren't having to sacrifice their income in order to care for their kids are really top of mind right now. And New York City has made monumental investments in the 3K and pre-K system, and that's a really great first step. But parents can't afford to wait until their kids are 3 years old to get childcare and to get back to work. So we really need to think about how to get affordable and accessible childcare in the hands of families under the age of 3.
Yeah, it's not working to live, it's living to work. Almost.
Absolutely.
Yeah, right.
Absolutely.
Right. Dr. Escobar, thank you so much for coming in and giving us insights. Thank you again.
Thank you.
Very important topic. Thank you.